Hello. Hello. My name is Monica, the nurse on duty today. Could you please give me your name? Yes, nurse. My name is John. And how may I address you, sir? You can call me John. Alright, John. What brings you here today? Well, nurse, I've come to visit you because of my 3-year-old daughter. She has chest tightness, wheezing, and difficulty in breathing. Oh, that must have been very difficult for her. But try not to worry, John. You have come to the right place, and I'll try my best to help you out. Now, before I proceed further, I would like to ask you a few questions first to get a better understanding of your daughter's problem. May I? Sure, nurse. Please go ahead. All right, John. Could you tell me what is your daughter's name? Yes, nurse. Her name is Sarah. All right. So, could you give me a bit more information about this problem, John? Like, for how long has Sarah been having this difficulty? Well, I think, nurse, I don't know, she has had this wheezing and difficulty breathing for about an hour. And what do you think might have caused these issues? I don't know, nurse. She was running around in the garden when she first started having difficulty breathing, but the symptoms are less severe now than when they started. I see. Did you try anything to deal with her symptoms? Any management? No, nurse, I didn't. I wasn't really sure what medicine I could give her or was supposed to give her, so I didn't give her anything. I hope that's all right. That's perfectly all right, John. Now, has your daughter ever had this kind of problem before? No, nurse, never. This is the first time she's experiencing all of these things. And how is her general health, John? Any recent illnesses? Well, her general health is fine, nurse. She hasn't been ill recently. Okay, and is she currently on any medications? No, nurse, she's not on any medications. I see. Could you tell me if she has a family history of asthma, hay fever, or eczema? Well, I know that my wife had asthma as a child, but I don't think anyone else in my family has had asthma, hay fever, or eczema that you have mentioned. All right, John. Thank you for answering my questions. What you have told me so far is that Sarah, your daughter, does not have a history of asthma, hay fever, or eczema, but your wife did have asthma as a child, and that Sarah is not on any medications currently, and she hasn't been ill recently as well. She first experienced breathing difficulty and wheezing problem while playing in the garden about an hour ago, and you did not give her any medications at the time because you were not aware which medications were right for her. Is that right, or would you like to add something to that, John? Yeah, that sounds about right, nurse. All right. Do I have the permission to examine your daughter, John? Sure, nurse, you can do that. Well, I have examined your daughter, John, and the good news is that all her vital signs are normal. Her condition is stable. There is only mild wheezing, but that's nothing to be alarmed about. What I will do next is I will share this assessment with the doctor, who will decide if there is any need for tests or further investigation. He will then give you the initial diagnosis and discuss the appropriate treatment plan with you. Is that okay with you, John? Well, I just want to know if my daughter has asthma, nurse. Can you tell me that? Because I'm pretty sure that she does. She does have all the symptoms of asthma, and it doesn't help that my wife has also had asthma as a child. Well, I understand that you're concerned about your daughter, John, and even though Sarah's symptoms are consistent with asthma, I wouldn't suggest that she has this condition until and unless she has been assessed by the doctor, because he's the right person to provide a diagnosis, not me. Moreover, asthma is difficult to diagnose at such a young age. Now, do you have any other questions or concerns that I can address for you, John? Well, I just really hope that I don't need to wait for the doctor for too long for my daughter to see a doctor. I appreciate your concern, John, and you will be glad to know that Sarah will not have to wait too long as the department is not very busy. So, we have plenty of doctors available. She'll probably be seen by a doctor very soon and will have a quick exam with the doctor, and then the treatment will be decided. Is that clear, John? Okay, yes, nurse, that's clear. Now, could you please wait in the waiting room? Sure, nurse, I can do that. Thank you, John.